Hi everyone. Today in this video we are going to discuss about methylprednisolone, how this drug acts, what is the mechanism, side effects, important precautions and clinical indications of methylprednisolone we will discuss in this video. What is this drug? Methylprednisolone, well known by its brand name Medrol. This drug is acting like anti-inflammatory agent as well as immunosuppressant. At a low dose, this drug acts as an anti-inflammatory agent, but at a high dose, it can suppress the immunity, so it can be used as immunosuppressant. That's why methylprednisolone is used in inflammatory disorders and in few of the autoimmune disorders, where it modifies the immunity as well as suppress the immunity. So today in this video, we are going to discuss about methylprednisolone. Now, this drug is useful in the various disorders like rheumatoid arthritis, which is an inflammatory disorder. Similarly, this drug can be used in few of the conditions like ulcerative colitis, which may produce inflammatory bowel disorder, and bronchial asthma, where methylprednisolone can reduce the attacks of asthma in the patients. And in the conditions like systemic lupus erythematosus, severe psoriasis, where it again modifies the immunity. In the treatment of atopic dermatitis, allergic conjunctivitis, leukemias, lymphomas, and multiple sclerosis, in various conditions, methylprednisolone can be used. Most of these disorders are associated with the inflammatory response, as well as few of the disorders are associated with the autoimmunity. In such conditions, methylprednisolone is useful as anti-inflammatory agent as well as immunomodulator. What is the chemical nature of this drug? So this is the structure of methylprednisolone. So here we have the suffix methyl to the prednisolone. So then what is the structure of prednisolone? This is the structure of prednisolone. Both are steroidal drugs. Now if we compare prednisolone with methylprednisolone, a methyl group is in excess at the 6th position in the methylprednisolone. So 6-alpha methyl derivative of prednisolone is nothing but 6-methylprednisolone. Now let us see how it acts. Methylprednisolone is a steroid. It acts on the glucocorticoid receptors. These receptors are coupled with the immunophilin and they are present within the cytoplasm. When this methylprednisolone binds to glucocorticoid receptors, they are going to be activated and they will undergo dimerization. And after the dimerization, now it is ready to interact with the nucleus. So the next target is the nucleus. Within the nucleus, it can interact with the genes. Now this dimerized complex can interact with the DNA, where it can produce a gene transcription. This gene transcription results in the protein synthesis, and it produces few of the proteins like annexin 1 as well as MKP1, which is the mitosin activated protein kinase phosphatase 1. In this way, methylprednisolone stimulates the gene transcription, thereby release few of the mediators which produce some anti-inflammatory response. So one of the anti-inflammatory action is mediated through the annexin 1. Phospholipids can be cleaved to produce the arachidonic acid or arachidonate. This reaction is mediated by phospholipase A2 enzyme. And after this cleavage, this arachidonate can be converted into prostaglandins as well as thromboxane A2 by COX pathway, cyclooxygenase pathway. In this way, prostaglandins as well as thromboxane A2 are going to be synthesized from the phospholipids, and these mediators can produce the inflammatory response, and it can also increase the body temperature, resulting in the hyperthermia. Now here, methylprednisolone can inhibit this synthesis of prostaglandins as well as thromboxane A2. This drug is going to induce one of the enzyme annexin 1. This annexin 1 can inhibit the conversion of phospholipids into arachidonic acid. In this way, all the mediators that are generated from the phospholipids can be inhibited by methylprednisolone. Similarly, this drug is going to inhibit the neutrophil apoptosis as well as it is going to suppress the NF-κB, nuclear factor kappa B expression. This gene, when it is going to be more expressed, it results in the release of inflammatory mediators. So methylprednisolone is not only promoting the few of the genes, but it is also inhibiting the another gene expression, thereby it is going to inhibit the release of inflammatory mediators. In this way, methylprednisolone produces some anti-inflammatory activity. Now let us see how it acts as an immunosuppressant. Whenever an antigen is present, this antigen is going to be presented by APC, antigen presenting cells. When this antigen binds to this APC, it is going to be digested, and whatever the fragment is expressed outside by MHC2 molecules. Now once this fragment is present in the MHC2 molecules, it is going to be identified by CD4 T cells, which are going to release one of the important mediator, IL-2. This IL-2 is responsible for the activation of the T helper lymphocytes. These T helper lymphocytes are present in the zero wing, which can be converted into Th1 lymphocytes as well as Th2 lymphocytes. Now Th2 lymphocytes are important for release of the cytokines. They can release few of the cytokines like IL-4, IL-5 and IL-13 and so many other mediators. All these are responsible for the inflammation as well as the immune response. Now here methylprednisolone can modify this immune response. Methylprednisolone can inhibit the gene expression of IL-2 gene such that production of IL-2 is going to be reduced. Similarly, it also inhibits the Th2 lymphocyte activity such that the cytokines are not released from Th2 lymphocytes. In this way, methylprednisolone can reduce the immune response, thereby it can reduce the inflammatory response. What are the precautions? Just we have discussed that methylprednisolone is going to inhibit the Th2 lymphocyte activity, and Th2 lymphocytes are responsible for the release of cytokines which are going to fight against the antigens. So when these Th2 lymphocytes are inhibited, it results in the immunosuppression, and this immunosuppression leads to increased risk of infections. That's why methylprednisolone can produce few of the infections when it is given at a high dose for a prolonged period. One of the important one is that methylprednisolone can increase the risk of herpes simplex infections. So when methylprednisolone is used at a high dose, it can increase the herpes simplex infections such that it can affect the eye and it can precipitate corneal perforations. So this drug should be carefully given in the patients who are having the risk of herpes simplex infections. Similarly, this drug can also increase the varicella zoster infections which can produce the chickenpox, and it can also increase the Mycobacterium tuberculosis which may produce some latent tuberculosis. That's why whenever this drug is given in the patients who are recovered from the tuberculosis, it may reprecipitate the tuberculosis. Similarly, it can also increase the strongyloid infections resulting in some threadworm infections. So all these factors should be taken into the account, and whenever this methylprednisolone is given, the risk of these infections may be increased. Another important one is the action on HPA axis. So this is the hypothalamus, and this is the pituitary, and this is the adrenal cortex. So this axis what we call HPA axis. From the hypothalamus, corticotrophin releasing hormone is going to be released which acts on the pituitary, and from the pituitary ACTH is going to be released. This is going to acting on the adrenal cortex, and from this adrenal cortex cortisol is going to be released. So cortisol is the endogenous glucocorticoid which can produce autoinhibitory effect on hypothalamus as well as pituitary. But when this methylprednisolone is given externally, it can also show negative feedback mechanism, and it can inhibit the hypothalamus as well as pituitary, which results in the inhibitory effect on the HPA axis. In this way, methylprednisolone can produce suppression of HPA axis, which results in the retardation of the growth in the children, mental retardation and adrenal insufficiency. That's why in order to eliminate this HPA axis suppression, this methylprednisolone should be given at a low dose, and the dose should not be stopped suddenly. It should be tampered slowly to reduce the dose. And sometimes when this drug is prescribed for a prolonged period, an alternative day therapy may be recommended where a high dose of the methylprednisolone is given on alternative days in order to reduce the HPA axis suppression. Similarly, methylprednisolone can also stimulate psychotic symptoms, and it can induce some psychosis in susceptible patients. So this drug can produce some euphoria, insomnia, lack of sleep. It can produce some mood swings in the patients and behavioral changes, severe depression as well as hallucinations in the patients. So if patient is already having any psychotic disorders, then methylprednisolone should be carefully given because it can further increase the psychotic symptoms. Similarly, methylprednisolone can also stimulate the peptic ulcers. So this drug can increase the ulcerative colitis in the patients. And finally, methylprednisolone can also increase the various other disorders, like it can increase the hypertension, it can increase the osteoporosis, it can increase the myasthenia gravis, which is a muscle disorder, and it can also increase the renal insufficiency. So all these factors again should be considered before methylprednisolone is prescribed for the patients for a longer periods. What are the side effects? Methylprednisolone produces few of the side effects like fluid retention and facial swelling, sodium retention which may lead to hypertension, and it can also increase the risk of congestive heart failure. All these side effects of methylprednisolone are observed because of its mineralocorticoid activity. So even it is a glucocorticoid, but it also shows some mineralocorticoid activity which results in the retention of sodium as well as water, leading to fluid retention as well as swelling. Similarly, this drug can show the side effects related to the different types of systems. For instance, it can act on the gastrointestinal system such that it can produce few of the side effects like peptic ulcers. Already we have seen it can increase the ulceration. It can increase the intestinal perforations, which leads to intestinal bleeding, ulcerative esophagitis, pancreatitis. All these are observed with the methylprednisolone. And it can also increase the liver enzymes such as SGPT as well as SGOT. So all these side effects should be closely monitored when this drug is given for longer periods. Similarly, its effect on CNS. It can produce headache, it can increase intracranial pressure, some vertigo, reeling sensations, convulsions, depression as well as hallucinations. All these side effects can be observed on the central nervous system. On the eye, it can produce glaucoma and it can increase intraocular pressure and it can precipitate cataracts, and even it can produce ocular perforations because of any herpes simplex infections. On the skin, it can produce some thin, fragile skin and it can increase the sweating. Some erythema can be observed resulting in the facial redness, and impaired wound healing is also observed because of immunosuppression. Similarly, on the endocrinal system, this drug can reduce the growth in the children. This is because of particularly suppression of HPA axis, and it can also precipitate Cushing syndrome, which is a collection of so many symptoms already we have discussed. So it can produce some swelling of the face resulting in the moon face. This is because of accumulation of the fluids, and it can produce some hypertension again because of the sodium retention, some bone loss because of any osteoporosis, and latent diabetes mellitus because of increased glucose levels. So all these may be collectively known as Cushing syndrome that can be observed in the patients. Similarly, it can increase the weight gain as well as hyperglycemia, hypertriglyceridemia. Both glucose and triglyceride levels are going to be increased when this drug is used for a prolonged period. Similarly, it can also precipitate some menstrual irregularities. How it is given? Methylprednisolone is available as a tablet, suspension, which is available for injection, as well as it is topically used in the form of gel as well as cream. But generally it is well prescribed as a tablet form. So initial dose of this methylprednisolone depends on the clinical condition because this drug is used for various types of clinical conditions. So the dose should be individualized based on the clinical condition as well as the patient conditions. Generally, initial dose is falling from 4 mg to 48 mg per day. And in order to reduce the HPA axis suppression and to reduce some side effects of methylprednisolone, this drug can also be given as alternate day therapy, where a high dose of methylprednisolone is given on alternative days such that the HPA axis is not completely suppressed and it can be recovered during the drug-free period. So this alternate day therapy is recommended when this methylprednisolone is used for prolonged period. So that's about this methylprednisolone, which is one of a steroid, and this steroid is having anti-inflammatory actions as well as immunosuppressant activity, and this drug can also be used in the adrenal insufficiency as a replacement therapy, and primarily it produces anti-inflammatory effects at low dose, and at a high dose it produces immunosuppression. This immunosuppression leads to few of the infections like herpes simplex virus infections, fungal infections, varicella zoster infections, tuberculosis, or strong lung infections. And recently, black fungus is one of the infection produced by the high dose of steroids. And this drug is useful in various inflammatory disorders as well as in treatment of the cancers like leukemias, lymphomas, and multiple sclerosis. In all these conditions, methylprednisolone can be given. But being a steroid, it produces various side effects on many of the systems. It can produce a swelling, fluid retention, and it can produce some Cushing-like syndrome. It can increase the osteoporosis, increase the glucose levels resulting in the diabetes mellitus, increase the triglyceride levels. It can increase the blood pressure leading to hypertension, and it can produce some glaucoma, cataracts, and it can reduce the growth in the children. And it can also produce some ulcerative esophagitis, some thrush in the patients. Even it is having so many side effects, methylprednisolone is highly useful in the inflammatory disorders. But in order to control the suppression of HPA axis as well as the side effects, this drug is recommended to be used at a low dose for shorter periods, and dose should be slowly tampered in order to reduce the withdrawal effects. So that's about this methylprednisolone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.